Welcome back. Thanks for staying with us. Healthcare workers around the world have been participating in a global week for Gazan Hospitals from Australia to Canada. Healthcare workers have been staging actions to protest the destruction of healthcare facilities and the targeting of healthcare workers by the Israeli military. In South Africa, protests were held in Cape Town, Durban and Johannesburg earlier this evening. And Western Cape Chair of Healthcare Workers for Palestine, Dr. Samah El-Boraei, joins us now via our video link for more on this discussion. Dr. Samah, thank you so much for your time this evening here in SABC News. Now, you were part of the protests taking place in South Africa this evening from around 6 p.m. Maybe you can just tell us, the one that you attended, how did that solidarity march go?
It went really well. I think about 200 to 250 people came out outside Red Cross Hospital in Cape Town, and they all showed their support. And, hundreds of healthcare workers came out, as well as all of the Palestinian Solidarity Campaign alliances. So I think that it went well. People showed their support at the destruction and the chaos that's happening in Gaza at the moment.
What is the significance of this protest? And of course, we know that there has been, the ongoing war we continue to see in Gaza and in Palestine. And perhaps, highlighting this must have been very important to you as healthcare workers.
100%. So this specific protest is part of an international global call for the release of Dr. Samah El-Boraei, who is the director. He's a pediatrician. I'm also a pediatrician, and he's a director of Samah El-Boraei Hospital. And this is the last functioning hospital in Gaza that has been completely destroyed. We've watched these harrowing videos of him walking towards the Israeli army tanks unarmed. He's a doctor. He was staying with his patients. He was trying to protect medical staff. We've seen pictures of babies on ventilators decomposing, and he was trying to save lives. And he got arrested. He basically is taken, his whereabouts are unknown, but we think that he's in the Sadeh Israeli torture camp. Most likely he will be tortured. And this is coming from, this is a healthcare worker. This is someone who all he did was stay behind to help his patients. Enough is enough. It's the last hospital in Gaza. I don't know what else the international community wants to happen in order for them to completely condemn what's happening. The situation is catastrophic. We've had, releases of, calls by the United Nations to boycott Israel. This is the situation we're in. So we came out in our hundreds to show our support and to essentially call for an end to the destruction and to call for a ceasefire.
And I mean, as this war rages on in Palestine, one focus, or maybe say two focuses, have been the issue around the attacks on healthcare facilities as well as schools. What is your take when it comes to observing international law and the attacks we've seen on very crucial parts in, when it comes to the healthcare systems in that country?
100%. So as you know, healthcare, hospitals, schools are protected under international law, under the Geneva Conventions. Nowhere else have we seen such blatant disregard for international humanitarian law that, if you remember, was actually set up post World War II and the Holocaust to try and make sure this never happens again. So you've got a complete disregard for Israel. The report that's come out from the UN, actually one should read it on the 31st of December that came out. It shows that Israel has had a pattern of repeated attacks on hospitals. It's the same type of thing. They shell it, they go in, ground troops, cause chaos and devastation, and then arrest all the patients and all the medical staff. It's a very good, report to read, and this is documented by the UN and Amnesty International. So this is not, this is a documented repeat attack on healthcare, which is supposed to be protected. It's an attack on schools, and it's utterly devastating and insane that Israel is being allowed to get away with it for this long. No one else would be able to get away with it for this long. It's medical apartheid, it's torture of healthcare workers, and we're just seeing it live.
And Dr. Samah, what is your take when it comes to what we've heard from the Israeli Defense Force saying that, well, the reasons for attacking, hospitals and schools is because that these facilities are actually being used by Hamas, as some sort of camp to control, how it operates, in Israel?
I'm not going to, give my own opinion. I'm going to give you what's in the United Nations report and Amnesty International reports. And the report says that about, out of like 19 hospitals, they've used the same thing, that, there is Hamas hideouts, it's military points. And yet the report actually says, it documents that what the evidence they give is very vague. It often contradicts public knowledge, and there's no actual evidence given. So it's being used as an excuse, and they don't even give any reasons for the other hospitals attacked. And we mustn't forget, this is not the first time that there's been attacks on, hospitals. Since the beginning of occupation, healthcare facilities have been attacked over and over and over again with specific patterns. You can't tell me every single hospital is hiding, a military campaign over the past 50 years. It makes absolutely no sense. But again, don't trust my word. Read the reports, go to UN, look at the work that people are doing, look at the evidence that's out there. The problem is that people are not doing that, and they'd rather believe the military, and they'd rather believe the government of a country over humanitarian organizations. And that's very, very, very sad.
I mean, it's a new year, it's 2025, and we've seen this war now take place for more than a year. It's heading into its second year. What are your hopes for the people of Palestine? And, are you hopeful that, there will be a ceasefire agreement reached and we can finally see an end to the war?
I am hopeful because I have to be hopeful, because without hope, there is nothing else. But it's going to take the entire global community, and firstly, South Africa, facilities and in medical institutions in South Africa to respond to Francesca Albanese's call for a global medical boycott of apartheid. It's time for us to put humanity and ethics over funding and over research, and it's time to stop muddying the waters. This is genocide. It's, Amnesty International has said it, the United Nations has said it, South Africa's taken, Israel's ICJ over this, and yet we still have medical fraternities in South Africa who were previously also on the wrong side of apartheid before. They've got a history of liaising with, of being on the wrong side of apartheid. We see them still basically making excuses for Israel and continuing funding and research. So we need to call for a global medical boycott. And if that happens in the medical world, and if that happens in every sphere, if every company, if every institution, if every group looks and reviews as its ties with Israel because it's committing a genocide, then yes, there's hope. But as long as people stay silent, as long as people don't unequivocally condemn what's happening and cut, economic and financial ties, there will be no future. But I'll tell you this, the activists will continue fighting for justice and for peace.
Dr. Samah, thank you so much for your time this evening. That is Dr. Samah El-Boraei. She is the Western Cape chairperson of Healthcare Workers for Palestine. Of course, just telling us more about that solidarity march that took place today in Cape Town, showing their solidarity for healthcare workers in Gaza.